So here we are then, just cleaning up that shiny surface on the back of the kneecap, the groove down the thigh bone, a little bit of inflammation in this what we call the fat pad area of the knee. So we're just going to debride some of this and just trim and tidy up. Aaron, I won't do an extra copy of this, just the one for patient. So we're nearly done now, sir. Just that groove down the thigh bone. Pretty worn out, actually, your old knee. You're sort of heading towards, actually, probably a knee replacement, which is not quite what we had intended for you. So there we are. The groove down the thigh bone. We'll take a probe and have a little look at that. Thanks, John. So we've got here the shiny surface on the back of the kneecap, which is 3/4 worn. You see where those little bubbles are collecting, and we can see there 3/4 worn there, with good cartilage on the edge just here. So that's normal, and you can see that's pretty worn out. And then on the back of the kneecap, globally sort of 3/4 worn, nothing quite down to bone. Down this groove in the thigh bone where it rubs, where you can see at the top of the groove in the thigh bone, if we rotate around, we can see here starting to get down to a little bit of cartilage left, but starting to show the pink of the arthritis through, and there a little osteophyte on the edge. So that's the medial trochlear, this side the lateral trochlear, sort of half worn out in places. So that's a pretty awful knee, I'm afraid, sir. So not quite requiring microfracture, but actually I think when it does need anything, it's probably going to be a replacement. And then we can go down to that medial side of the knee, just to remind you, that medial side of the knee down here, loose bits floating, and we'll just wash those out at the end. And here we've got that large area of damage, a great big trough right from the front here, right the way around to the back. As you can see that actually the probe is still on trouble right the way to the back. Meniscus okay, little osteophytes, and then that lateral side of the knee over here, with bent up and sort of 3/4 damage on that area just here. So pretty awful knee, I'm afraid, sir.